Hello, my name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressive. Thank you for joining me to learn about expressive and receptive language disorders. As a parent or caregiver, it can be stressful to watch your child struggle to communicate. Your child might have a tough time understanding what's said to them, or they may struggle with verbal communication. They know what they want to say, but they can't express it clearly. Problems like these are related to language ability, which refers to how we use words to share our thoughts and express our needs. The good news is that speech therapy is highly effective in improving language disorders. But first, it's helpful to understand what kind of language problem your child may be facing. So let's start with the basics. First of all, what causes a language disorder? The cause isn't always known, but these disorders are often the result of a health problem or disability. They may be linked to pregnancy complications such as premature birth, low birth weight, or poor nutrition. Autistic children and those with Down syndrome or cerebral palsy are at a higher risk of language disorders. Also, in many cases, genetics may play a role. Children with a family history of language impairment may have a higher risk. Language development can be split into two categories: receptive language and expressive language. A person may have a problem with one type or with both. Let's start with receptive language. In the broadest sense, receptive language refers to the comprehension of spoken language. As children grow and develop their communication skills, they must first be able to understand language in order to use it appropriately. A receptive language disorder means a person has a hard time understanding language. Children may struggle to grasp the meaning of what people are saying to them. This can make it difficult to make sense of the world around them. A child with a receptive language disorder may have a hard time with things like taking part in simple conversation, participating in a shared task with another person like doing a puzzle, identifying named objects or photos, following directions, or understanding questions that people ask them. Now let's move on to expressive language. This refers to a person's ability to verbally or non-verbally express their thoughts, needs, and feelings. If someone struggles in this area, they may have an expressive language disorder. A child with this type of language disorder may understand what's said to them, but they have trouble expressing what they need to say. They may have a hard time learning and using new vocabulary words or understanding how to string words together in a way that makes sense. That can make telling a story or answering questions pretty challenging. An expressive language disorder can be particularly tough to deal with. Oftentimes, children know exactly what they want to say, but it doesn't translate into the right words or a clear sentence once they begin talking. Can you imagine how frustrating that would be? So it's understandable that children with this disorder may feel extra upset when they can't communicate. An expressive language disorder can be a bit more obvious than a receptive one. You might notice signs like these in your child. They may grunt or make sounds instead of using words. They may have difficulty gesturing to express their wants and needs. You may notice a lack of variety in their consonant-vowel combinations. In other words, they may be limited in the kinds of speech sounds they make. Your child might not use many words. They may have a tough time forming phrases and sentences or using correct grammar, and it may be hard for them to answer questions. It's not hard to understand the importance of having strong expressive language skills. All of us need to be able to clearly communicate our thoughts, feelings, and desires. If a child has problems with expressive language, it may cause frustration and affect their self-esteem. Safety is also a concern if a child can't share details about an event, answer questions fully, or tell basic information like their name, phone number, or if they're in pain. These are all important reasons why we want to diagnose and treat any language disorder as quickly as possible. While expressive and receptive language disorders can exist individually, they also often appear together. We refer to this as a mixed receptive expressive language disorder. Oftentimes, if a child's receptive language is delayed, that can affect their expressive language skills. There can be problems in both areas. However, it's important to note that just because a child is delayed in expressive skills doesn't mean they struggle to understand language. It's clear as mud, right? The bottom line is this: no two children are the same. Every child has a different mix of strengths and areas for growth. That's why it's vital for a qualified speech-language pathologist to evaluate your child and determine where they may need treatment. Again, speech therapy is highly effective in improving language disorders. So, let's take a minute to recap what we've discussed today. A language disorder can be caused by a health problem or disability, but the cause isn't always known. There are two categories of language development: receptive language and expressive language. A receptive language disorder affects a person's ability to understand language. An expressive language disorder affects a person's ability to verbally or non-verbally express what they want to say. While there are signs of each, an expressive language disorder can be more obvious than a receptive language disorder. Finally, both language disorders can exist together. My hope is that all this information helps you observe and understand your child's communication abilities. Remember, if you're not sure whether your child is on track, reach out to a speech therapist. We're here to help, and early intervention for language disorders can make a life-changing difference in how your child experiences the world.